Hi everybody, this is a video about functional neurological disorders. Just before I jump into the crux of the video, if you could just take a quick second to please like or share or subscribe or just make a quick comment, even giving me a thumbs up in the comment section below. I'd really appreciate it. It just helps to support my channel, helps to make it a bit more popular in the algorithms, and just if you think my content is useful, then it'll get out to more folks who might also find it to be useful. So thanks in advance for taking a second to do that. So somebody posted a question on one of my other videos just asking if I could speak a bit to functional neurological disorder, and in particular if it has a facet of essential tremor. So as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So just to define a couple of terms here for folks that might not be overly familiar with functional neurological disorder. So it used to be known as conversion disorder, and my general understanding of it is it's when folks have certain neurological symptoms. It could be weakness, could be full or partial paralysis, could be a tremor, just various things you'd think like, oh, there must be some neurological disorder going on, and yet there's no organic cause of that can be determined. MRIs look fine, blood work looks fine, physical exams look fine, EKGs, or rather EEGs and EMGs and things, everything looks fine, and yet the patient's having these symptoms. And so basically the cause is unknown, and it can be related to, potentially triggered by different maybe some correlations with history of trauma or certain like psychological factors potentially, but sometimes just the cause is just not known, so they call it functional neurological disorder. And then an essential tremor, which is just kind of a funny name. So it's like essential things are usually things they think, we really need this, like we definitely generally don't want a tremor, but an essential tremor is, for all intents and purposes, this tremor that's just happening for some sort of hardwired physiological reason, and it's not due to some like health pathology or something like that. It's just kind of like something is just happening because. So that's essentially what an essential tremor is. So with functional neurological disorder, what I think add to the conversation about this is that in my world and in the world of many of my colleagues who focus on complex chronic illnesses, we work with so many patients where they come in saying, everything looks fine on my blood work and my imaging results and all the testing that's been done, and yet I'm still not feeling great. So what's going on? And so some of those folks could very well get the label of functional neurological disorder. Indeed, many folks that wind up in hindsight having issues with mold toxicity or chronic infections with Lyme or other infectious microbes, they have a lot of neurological symptoms, and sometimes there are tremors, and I've had patients with like full-blown seizure-like activity but on an EEG they're not having a seizure, so it just doesn't quite fit into that mold, so to speak. Some people have these internal body vibrations that they describe. Like there's various things that I think would ultimately fall under that umbrella of functional neurological disorder. However, they just haven't necessarily been given that label per se. So in folks with functional neurological disorder, while unfortunately there really aren't a lot of, if you will, mainstream interventions that are available, if somebody came into my practice with functional neurological disorder and they wanted to dig deeper to see if maybe we could discern some organic cause that just hadn't been picked up yet, then things that I would be thinking about would certainly be screening for mold toxicity, screening for possible chronic infections, screening for certain nutrient deficiencies. I think, I posted a video about this a little while, not too long ago, within the last week or two, about this really great interview on the Better Health Guy podcast. There's a medical doctor from the UK named Chandler Marrs, Marrs, like the planet with an extra R, and she was speaking all about thiamine deficiency, which is vitamin B1, and all these like just widespread manifestations that can potentially come to fruition if somebody's deficient in vitamin B1. And she spins, a very good yarn about how this might be something that's really relevant to a lot more folks than we might expect. And so, looking at certain nutrient deficiencies with various, B vitamins or other things that are required for proper mitochondrial function, etc. Maybe looking for heavy metals, depending on the case. I just got test results back on another, sorry, just getting a text from my wife, so slightly distracted. Just got test results back on a patient who's been dealing with chronic health issues for a long, long time, and so many things have been explored. He's worked with a variety of other healthcare practitioners and just sees me from time to time to get my 2 cents. And just got back results on lead levels are very high, mercury levels are sky high. It's like, oh man, like I'm really excited for this patient from the perspective like, oh, we've got something really, really notable to sink our teeth into, and that could help to explain a lot of his chronic symptoms. He doesn't have functional neurological disorder, but he has a lot of other symptoms that otherwise have not been explained through despite much investigation with a lot of different clinicians. So it's kind of similar to the same song and dance, where if patients were to come in with chronic fatigue or chronic pain in their muscles or joints, or chronic brain fog issues or whatnot, like the symptoms that a lot of my patients come in to see me with, be thinking about the same types of things. And of course, we're not just going to, well, maybe I shouldn't say of course. I mean, some clinicians do just test for everything, and if patients can afford that and are willing to go through that process, that's wonderful. But of course, again, maybe not of course, but anyways, at least in my practice, if a patient came in with a functional neurological disorder, I'd be thinking about all these potential causes, but trying to hone in based on their history with, where we should be starting and what we should be investigating first, and kind of going from there. So thank you for the question. I hope this was helpful. If you have any further questions about this topic, please feel free to ask. And if anybody has questions about this topic or anything else, just post in the comment section below, and I'll do my best to answer as soon as I can.